Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will discuss the presentation of appendicitis, the symptoms associated with the condition, as well as its diagnosis and treatment. Appendicitis results from inflammation of the appendix. The appendix sits in the right lower abdomen near the large intestine, particularly a part known as the cecum. The role of that the appendix plays in the human body has been unclear in the past and was thought just to be a rudimentary organ. However, there is some evidence that the appendix plays a role in immunity, particularly in the pediatric population, as B and T cells mature. The typical age of presentation is between 10 and 30 years old. Approximately 250,000 Americans are diagnosed with appendicitis every year. Appendicitis can either categorized in two ways: complicated and uncomplicated appendicitis. Complicated appendicitis involves the rupture of the appendix, whereas uncomplicated appendicitis does not involve its rupture. There isn't one particular known cause that results in the development of appendicitis. However, since the appendix is attached to the colon, it is thought to be due to blockage within the appendix, which then results in the blood supply being cut off. Also, something to keep in mind is that age plays a factor in what the most likely cause of the blockage could be. Since the appendix plays a role in immunity in the pediatric population, one of the causes of appendicitis in children is what is known as lymphoid hyperplasia, which is an increased number of cells that play a role in helping the body fight infections. So for example, a viral infection can trigger this, and as the cells increase in number, it can cause the appendix to be blocked. In adult patients, the most common cause of the blockage is what is known as a fecalith, which is when stool becomes lodged within the appendix. Although the appendix is located in the right lower quadrant, as I mentioned previously, the symptoms don't always start there. The pain is usually first felt around the belly button area, and as the symptoms progress, the pain starts to travel toward the lower part of the right abdomen. This area is known as McBurney's point. When examining patients, placing pressure in this area will elicit pain, which is highly sensitive for appendicitis. Other symptoms that can be seen in patients with appendicitis are abdominal discomfort, bloating, nausea, vomiting, fever, and a loss of appetite. There is a risk of rupture if appendicitis is not treated in time. The ruptured contents can then spread throughout the abdomen and result in peritonitis, which is a serious complication and needs to be treated with emergency surgery. Hey, your friendly neighborhood doc, just checking in. If you feel that you or someone you know may be experiencing any of the symptoms described in today's video, please speak with your doctor or a licensed health professional. The diagnosis of appendicitis typically involves a physical exam, blood work, and imaging studies. Since inflammation is present, there will be an increase in inflammatory markers such as WBC count and CRP. The physician will also check for any abdominal rigidity, which is stiffening of the abdominal muscles. As I mentioned previously, applying pressure over McBurney's point will typically elicit pain. During a physical exam, there are also 3 signs that can be used to help diagnose appendicitis. They are obturator, Rovsing's, and psoas sign. The imaging tests usually done in this scenario are either an ultrasound or CT scan. Lastly, I want to close out today's video and discuss the treatment for appendicitis. The traditional treatment for appendicitis is an appendectomy, which is the surgical removal of the appendix. I want to point out an important exception here. If an abscess forms around the appendix, the abscess is first drained, and the appendectomy is performed a couple of weeks later. An appendectomy is typically done laparoscopic. It is on occasion done via open laparotomy. However, this is typically reserved for patients who are exhibiting more serious complications of appendicitis, such as rupture leading to peritonitis, or have developed an abscess, as I mentioned previously. In most cases, laparoscopic appendectomy is the preferred surgical technique because of its advantages of shorter hospital stays for the patients, lower risk of infections after the surgery, and patients are usually able to return to their everyday activities more quickly. In recent years, there have been studies done regarding the use of antibiotics as first-line management in patients with appendicitis. In one article from the New England Journal of Medicine, which I will link below, compared safety outcomes in patients who underwent an appendectomy and those who were only given antibiotics. In the patient group that was only given antibiotics, 40% had to undergo an appendectomy by 1 year post-treatment. It also seemed that a good portion of these patients had a more complicated form of appendicitis. That's all from me today, but if you're enjoying this type of educational content, be sure to like, comment, and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments, and I'll try to make a video on it. Here is another video I thought you might like and my latest upload in case you missed it. Until next time. Bye.